So your Aunt Lisa is complaining of a headache, and she's having pounding in her ears. What do you do?
I don't know.
As a nurse, I recognize that these are symptoms of high blood pressure. And so that's why today I'm going to be teaching you how to take your blood pressure. And I have two different methods, manually and then automatic. I'm going to be showing you how to take it and how to interpret the readings, and as well as what to do if it's high. First, you're going to have to ask a few questions. You're going to want to know if your aunt already has high blood pressure. In Saunders, it's considered high if it's greater than 120/80. You're going to ask also if she has a limit to which arm she can take her blood pressure in. For example, some people, if they've had breast cancer and they've had to have a breast removed on whichever side, you can't take it on that side. Another reason could be because they had surgery, or they are getting dialysis and they have the graft in one arm, so you want to stay away from that arm as well. So now that we know a little bit more about Aunt Lisa, we can look at our tools, and I'm going to explain how we can use them. One tool I have is the manual cuff. This is the cuff, the burgundy part, and it comes with the big bone manometer. Long word, it's just the gauge, and then it comes with the pump and the dial that is used to inflate the cuff. And with this, you're also going to need a stethoscope if you have one handy. And the stethoscope is placed in the bend of your arm, wherever the cuff is at. And then that's how you listen for the whooshing sounds. That's going to tell you where to start and stop your numbers. But for the purposes of today, I'm going to be using the automatic cuff. And I have one here. And this one comes with a standard cuff, and it has the artery marker on it. It shows you where to place the cuff. The artery mark is going to go on the inside of the arm where you would have put the stethoscope in the bend of your arm, because that's where that artery is. So you place it there, and this one is fairly straightforward. It has the systolic blood pressure and the diastolic blood pressure. Systolic is the top number, diastolic is the bottom number. And remember, 120/80 is what you're shooting for. Okay, so it's important to select the correct size. If it's too big or it's too small for your arm, it could read wrong. If it's too small, it's going to read as high. And if it's too big, vice versa, it's going to read as too low. And there's guides on the box, usually, that it comes in to select the correct size for yourself. So we've gone on with that, the supplies, and what the numbers mean. Now, I'm going to demonstrate on my volunteer, Janaya. If you want to come up and look at your blood pressure. Okay. So just uncinches. Make sure that that mark, like I said, is on where the artery is. Make sure it fits snug but not too tight. And this device is straightforward. You just push the button and it automatically pumps it up. And so while you're waiting and it's taking the blood pressure, and you see that Aunt Lisa has a blood pressure of 160/110. That's considered high according to Saunders as well. When it's that high, you're going to need to call your doctor and tell them what's going on and how you're feeling. And if you're having symptoms like changes in your vision, chest pain, you can't catch your breath, you're going to need to go to the ER. Thank you. Thank you. you're not, and if it's just slightly elevated, it's not that high, if it's over 120 over 80, then you're still going to want to make a doctor's appointment. And they're going to, from there, they're going to decide if it's consistently staying above that level. And he's going to suggest that you make some lifestyle changes. And that includes incorporating more fruits and vegetables and grains into your diet. There's many diet plans that you can find online. If you go to a gym, there's diets that you can find there that can help you to stabilize your blood pressure or even reverse it and improve your blood pressure. Another thing that you can do to help your blood pressure is to reduce the stress in your life. That's an overlooked contributor to high blood pressure. And the way I think you can reduce the stress is try to prioritize what's important. Some people feel overwhelmed because they can't get everything done in a day, and you just have to, it's okay to just let some things go. Do something for yourself. Take yourself shopping, or if shopping raises your blood pressure, maybe you want to take a warm bath, read a good book, something to reduce that stress. You also want to incorporate exercise into your daily routine. It doesn't have to be anything strenuous. Just to maintain your blood pressure, you could take a walk. 30 minutes a day for 5 days is what they would recommend. But that doesn't have to be all walking. It could be doing some heavy-duty housework for 30 minutes a day. That gets your heart rate up, get some sweat going. That's good enough to stabilize your blood pressure. So, in summary, we've talked about what to ask before you get the blood pressure, find out if there's any underlying things going on, anything you need to know about taking the blood pressure. We learned about the cuffs that you can use and how to put them on properly and to fit the right size. And we also talked about what to do if it's high. So we know how to safely manage it here in your lifestyle, and when to call the doctor or to go to the emergency room. So now you know what to do with your Aunt Lisa when she's having that headache and pounding in her ears. Thank you for your time.